Good evening, all participants. Today is the 25th day for this Basava Accu Academy Diploma course. And last day, we see more practicals in our session. Today also, analysis of pulse and live practical explanations will be continuing. On behalf of all of you, I am inviting Basara sir to this platform. Good evening, sir. Welcome, sir.
Good evening.
You can take care of the session, sir. Thank you.
Thank you. Good evening, all. So, welcome you for traditional energy medicine. Good evening. So we are discussing a tongue diagnosis yesterday. So this comes under the observation of the patient. So totally traditional Chinese medicine has 4 different types of diagnosis. One is observation. The second one is the occultation. The third one is interrogation. The fourth one is taking pulse. So observation, we seen patient tongue diagnosis we are observing, and in last elemental class we seen the observation of body with the different colors, pain, and skin, hairs, all those things we discussed in the different elements. Even patient voice also plays very important role here. That is called occultation. Here, whether the patient belongs to the yin or yang, you can find out with the just sound itself. So if you're able to find out some data by observing and by occultation, then the third method is interrogation. For example, you observed the eye is little yellowish. That yellowish nature, it is indicating about the liver and stomach fire. The white eyes is indicating the liver coldness. You know what happens when liver Qi stagnates, when there is a liver in rises. You can ask few questions which is related to liver coldness. If there's a red veins you can see in the eyes, then you can ask some questions which is related to liver fire. Similarly, if you are observing some dryness in the face and in the skin, so that is indicating the dryness. So you can interrogate the patient which related to lung dryness. When there is a lung is dry, skin and ear also become dry, even stools become dry. Even you can ask few questions related to any cough and allergy related issues with respect to patient. So your interrogation is completely based on your observation and occultation. Okay. No. ಎಲ್ಲರಿಗೆ ಆಯ್ ಹೇಳು. ಎಲ್ಲರಿಗೆ ಆಯ್ ಹೇಳ್ಬಿಡು. You tell I. ಎಲ್ಲರಿಗೆ I ಹೇಳಲಿ.
We cannot see the face of your daughter, sir. We cannot see the face of your daughter.
Oh, ಹಬ್ಬ ಐತೆ ತೋರಿಸ್ಬಿಡು. See, most of the times I diagnose my daughter. Oh, she's showing where is the book. ಇಲ್ಲಿಮ್ಮ. ಹೌದಾ? ಓ, ಅಲ್ಲಿ ಬಿದ್ದುಬಿಟ್ಲಲ್ಲ. ಆಯ್ತು. ಹೇಳ್ತೀನಮ್ಮ. ಸರಿ. ಆಯ್ತು, ಟಾಟಾ ಮಾಡು. ಯು ಸೇ ಟಾಟಾ.
ಟಾಟಾ.
ಅಲ್ಲೋಡ ಆಂಟಿ ಬಂದ್ರು ಅಲ್ಲಿ. ಟಾಟಾ ಮಾಡು.
ಟಾಟಾ.
So especially kids, they're not expressing the voice. So there you have to give more importance to the first and second method. You have to observe the skin and you have to observe the breathing patterns, and then okay. ದೊಡ್ಡದು ಬೇಕೆ? ದೊಡ್ಡದು ಇಲ್ಲಿ ಕೊಡ್ತೀನಿ ಬಾ ನಿನ್ಗೆ. ನೀನ್ ಬಾ ಇಲ್ಲಿ ಕೂತು. ಓಕೆ, ಟಾಟಾ.
ಟಾಟಾ.
ಅವ್ರು ಎಲ್ಲರಿಗೆ ಪಾಠ ಮಾಡ್ಬೇಕಂತೆ. ಹೇಳ್ಕೊಡು. 1 2 1 2 3. ಸರಿ, ಅವರೆಲ್ಲ ಕಲ್ತ್ಕೊಂಡಿದ್ದಾರೆ. ಎಸ್, ಫೈನ್. ಸೊ ಇವಾಗ ಅಮ್ಮನ್ ತಗೋಗಿ ಪೆನ್ ತಗೊಂಬರೋಗು, ಇವ್ರಿಗೆಲ್ಲ ಹೇಳ್ಕೊಡೋಣ. Just a minute, I'll come back. Welcome back. My voice is clear? Fine. So many times we think that oh, what is the use of observing the patient? I know the pulse, I know the tongue, I can get the data. No. Always the first priority about your diagnosis, it goes with observation. You have to observe everything: color, structure, moisture, sound, the pain area. Many people, they very clearly tell. Okay, when I see the knee area and all, you can see the swelling and you can see the some wrinkles. So all those things is giving the information to you. You are not a doctor to give a common medicine. If 10 different people is having high blood pressure, is there any 10 different medicines? No. Do you believe all 10 patients is having same root cause? No chance at all. How you can say they don't have same symptoms, same root cause? Everyone is having different root cause that you can diagnose in the first way based on the observation and based on the symptoms. When you interrogate the patient, one we tell, whenever my BP rises, I'll get giddiness. Who is controlling the direction in your body? It's the wind. Direction and time is controlled by the wind. Someone will tell, when a BP rises, I'll get a headache here. Front side of the body, this area is controlled by stomach. Definitely their BP is rising due to stomach heat. Somebody complaining whenever BP rises, they'll get the backside headache. The backside headache is due to kidney coldness. So for many people, the BP is rising due to the mental irritation, the anger. This is due to gallbladder wind. For few people, the BP is rising due to more water accumulation in the body. So that is a kidney coldness. Kidney is unable to eliminate the water. The water is increasing. When water increases, coldness increases. So heat goes down. When heat is going down, the BP is maintaining your body heat with circulation. Your heart is maintaining it. Automatically it will rise up. Even your lung chi deficiency also rises your BP. How can you tell that? Who are all complaining breathlessness due to high blood pressure? All those people is having lung chi deficiency. So what it means? Each diabetic, each high blood pressure is having a different root cause. I am not telling that, patient is telling it. The patient in symptoms are telling that. How can you give a same medicine to all the patient? It's wrong. To get conclude, all four methods are important. So observation, occultation, and interrogation. Then you have to take the pulse to confirm it. You are thinking that you have giddiness. If it is giddiness, definitely it is a liver wind, is excess. That liver wind, you have to cross check with the pulse, whether wind is there or not. So pulse is also a very rare diagnosis, very important diagnosis. But before that, you have to do observation, occultation, interrogation. All three. Clear for you? Many times, many people, they are doing mistake, even including myself. Few years back, I used to treat with only pulse or only observation, only tongue diagnosis. No. That you get with experience. All four are required to make proper diagnosis. All four: observation, occultation, interrogation, taking pulse. Clear? So Purnima is asking left chest pain. The answer is there in your question itself. If anybody of you are getting left chest pain with the left hand numbness, what it means? Left is in, right is yang. So the patient is having in is excess. Again, where? Upper body, because liver meridian is governing it. It's a liver in is excess. You only left leg is pain, then you can either spleen or kidney in is excess. If anybody complained only left knee pain, There is a kidney yang deficiency. If the left hand pain, left chest pain, there is a heart yang is deficient. Clear? Don't treat heart with the left side chest and pain. By treating heart, you will get results within few hours. But within few days, it will go again, you will get back. Because upper part of the body, the yang is controlled by liver. The yang is controlled by liver. So just raise liver fire, you'll get permanent solution. Got it? Left side, because on an average, every week, we will get 10 to 15 patients with the same symptoms. Same. Before coming to us, they visited minimum 5 to 6 different cardiologists, doctors. They do all the tests. They tell you are normal. It's happened due to gastric, take gastric medicine. The moment you take gastric medicine, you are reducing the stomach heat, still problem increases. And there is no modern devices to find out the liver Qi stagnation, liver yang deficiency. Through pulse, through symptoms, through traditional energy medicine analysis, you can diagnose. But there is no tools in the modern medicine which detects your heart, kidney, yang deficiency much before. So that's what strongly believe this system and adapt all four to make proper diagnosis. And interrogation also plays very important role. What you learned in last 3 months, all you have to take notes and watch videos twice, thrice. In each and every meridian and every organ, I told how it works: physical, emotional, intellectual, and spiritual. You can make some questions out of it. If I told liver in is storing the blood and nourishing the muscles. If anybody tells a muscle pain and tiredness, then it's a liver blood deficiency. Then you have to make a question on it. So you can make 10 to 15 questions on each meridian for excess as well as for the deficiency. You just make a question and keep it with you. So whenever patient comes, if you are suspecting stomach is the issue, you have a question, 10 questions in the stomach yang and 10 questions on the stomach yin. If you feel patient is telling stomach yang, stomach heat, I told very clearly, you overall having stomach heat, they have forehead headache, eye burning sensation, hot breath, mouth ulcers, gastric problem, initial bowel will be heat, okay, and chest pain, epigastric pain, okay, and you will also get leg pain, eye burning sensation, air fall. See all these things. It's all 10 questions. Now I told 10. Just keep it with you. 10 questions for the stomach yin and 10 questions for stomach yang. If you are suspecting stomach yang, ask 10 questions, make sure that is having stomach heat. Then you go for pulse. Okay, stomach pulse is excess or not. If it is excess, your assumption is right. Or else you have to rework on it. Clear? So by next week, for all of you, this is the homework assignment. I'm not expecting which and not taught to you. Already everything I taught. If you have a doubt, you just go through a video and yourself just make 10 points, yin and yang. If you take liver, for liver yin, 10 questions. For liver yang, 10 questions. You make it. When you work on it, then only you learn. I can give you ready-made, I have already. The moment I give, you study and you'll forget. That's what happens in the examination. All of us, we wrote, we forget. But if you find the questions yourself, you never forget in your life. Okay. Make a note. That is a answer for your interrogation questions. Okay. Then come to the taking pulse. So why we need pulse? What is the importance of the pulse? We'll see. Pulse is one of the dominant diagnosis factor because it won't change. It takes a few weeks to few months to change. So while doing a pulse diagnosis research, before doing Nadiswara, so first in my lab, I got a different pulse diagnosis tools, how they are working. And I took one of the pulse diagnosis device. I took 4 or 5 times. Each time it is showing the different pulse. Then I asked the person who is selling the device, if it is keep on changing the pulse, then what is the necessity of taking it? What is the necessity of taking it? Then he told, no, your thoughts changes now every minute, that our pulse changes. Do you agree that everybody thought changes every minute? Then if his pulse is also changing, means why to take pulse? It's no use. No use at all. Pulse diagnosis is a tool. It should remain constant unless you are not influencing it. Unless you are not giving time to heal. You can take our Nadiswara after taking dinner, after taking breakfast. Anybody ever took the pulse after food? Who is having Nadiswara? After taking food, have you took a pulse report through Nadiswara device? I'm telling you, if you want to, you can observe that after taking food, if you take Nadiswara, your immunity element will be high. Why? Any guess? Why humidity is high after taking food? To understand this, you should understand what is the pulse. From where this radial artery comes? It is coming from the heart. Then what is the roles and responsibilities of the heart? What is the roles and responsibilities of the heart? My question. According to doctor, I will tell, this is the organ which supplies blood to the body. So I'm telling you, blood is a element in the body which contains everything. All 5 energies, Vata, Pitta, Kapha, Chi, blood, your oxygen, everything is there in the blood. So where you can find all 5 elements means it's in the blood only. So that blood is doing 2 jobs in the body. One is it's nourishing the organs. Another one is working as a communicator. It is communicating to all body. Blood start coming here. It takes the information here. What is going on? Oh, this tissue is damaged. It's a problem. Then that data, it given to all throughout the body. See, if there is a cracks here, that skin is peeling out. There is a liver blood deficiency. Okay. There is a liver heat is more. Liver yang is more. That information is given to all the cells in the body. It is also given to the kidney. Then that information is captured by the kidney. Oh, there is my son is don't have sufficient in. Then who is the mother of liver? Is a kidney. The kidney started producing more in energy to give it to the son. So the information which is there in the blood, it will communicate with all the body. Blood has to, we can tell 100 jobs of the blood, but if you mainly categorize 2 jobs, one is nourishing the cell, another one is communicating between the cells. To do this, do you know how much time body takes? That blood takes? It's 8 to 8.3 minutes. 8 to 8.5 minutes. Not 8 seconds. The blood which is from here, it is going now to cover all body again coming back. It's a 8 to 8.5 minutes. That's what we are keeping methi or pepper seed for 10 minutes. If we keep for 10 minutes, actual timing is 8.5 minutes is enough. The information which is given by you is circulated throughout the body. That's it. Okay, you are putting methi, pepper or magnet, you are triggering it. How you can understand that language of blood? You told blood has 2 jobs. One is nourishing, another one is communication. Each and every organ are communicating each other. That art is just one mediator. Art is a mediator. That's it. He makes your communication easier and smoother. One is speaking German, other one is speaking Russian. They can understand with some signs, but who makes that communication easy? Is a mediator who knows both the languages. So like that, each and every cells, they are capable of talking each other, communicating each other. But that job made it easy through art. He is the one which makes communication easier. The moment you took the food, immediate, the heart sends a signal. Heart sends a signal to the through blood. Through blood, they will send. What? By saying that I got a work. I have to digest the food. That too, it took so much of food. I have to digest it. To digest that food, I need more chi and blood. That he communicates. That the moment it communicates, the heart will send more blood and chi to the stomach. That pulse you can observe here in the stomach pulse. That will in the shape of humid nature, bulge in nature, earth element. Once the food is digested and eliminated and transformed and transported, then stomach and digestion system tells, you just give me the minimum blood and chi. I can manage. I don't want more. So if you take the report in the Nadiswara, 99% of the time after food, you will get humidity pulse. Provided you don't have other serious issues. Because if some other is having serious issues, even while taking food also, they are raising the request. Leave it the food. Yeah, I'm unable to survive. You give food to me. Or else after food, humidity pulse. For few people in the empty stomach also, they're getting humidity pulse high. So that's because there may be some issues, some healing has to happen in the stomach, and stomach is keep on raising the request through blood to the heart. So the humidity is high in any of the patient. I think many of you are having Nadiswara reports. That's what I'm giving example. You may have humid dry or humid heat or humid cold. There is a different way again. Within digestion system also, there is a 5 energies. If you are getting humidity and dry, that is telling stomach chi deficiency. Humidity, heat, that is indicating stomach yang is more. Humid cold, that is indicating spleen and stomach yang deficiency. Humid wind, that is indicating spleen blood deficiency. Wind means deficiency. So how your 5 elements in the digestion system, you can get through the pulse itself. If you take the pulse after bowel and after urination, then your dryness pulse will be more in Nadiswara, air element, which is responsible for elimination. If you are getting excess of heat pulse along with humidity, then it is a damp heat in the digestion system or heart blood deficiency also. So that pattern, all the patterns I will explain in the coming weeks. I'm just giving the importance of pulse diagnosis. Through pulse, you are understanding the communication between the cells. So after urination, pulse will vary. Before urination, it won't vary. Before taking lunch, it won't vary. But after taking bath, it will vary. After taking food, after long walk, it will vary. So that's what pulse should be taken in empty stomach. Empty means any time of the day. Minimum after 3 to 4 hours of food. At least 2 hours. Clear? So pulse which you are checking is the most powerful diagnosis tool to understand the communication between the cells. Again, that pulse changes based on your breath, emotions, and thoughts, but not immediately. If you are having fever, you will have dryness pulse because when you get fever, your fluids will drain out due to heat. Your dryness will go off after you relieved from the fever. It won't go off after 5 minutes. Clear? And the same thing you can decode and you can understand the patient emotions and thought patterns through pulse itself. So what you're observing in the pulse? We are observing the force, momentum, rate, rhythm, speed, everything. So all together it is telling the information about the body and organs. So first, before going to check the abnormal pulse, you should check how is the normal pulse. Then only you can observe the abnormality. So first, it should have stomach thick. The second, it should be aspirate, means it should have some force. And it has to root. Root means the pulse should start from the base. Whenever you touch any pulse, it should not go superficially. It has to start from the root like this. It should not come feeble like this or floating like this. That both are abnormal. Okay. And pulse also changes with the seasons, with the genders, with the occupation. This is a small influence. In summer, heat rises. In winter, cold rises. In rainy season, dampness will increase. In autumn season, dryness rises. Because when energy changes in the atmosphere, obviously it is influencing your body also. Because you are part of the nature. That is very minimal. Okay. And even body fluids after taking water, menstruation, pregnancy, those things will vary. But in smaller way. Okay. So this is the radial artery below the thumb. You can check this area. Please check that. If you're not getting proper pulse, you can move even horizontally as well as vertically. Both you can move and check. So all of you check pulse once. How yourself feeling the pulse. Just press 100% and release 30-40%. You can see the changes. You can see, observe the pulse. First step, just observe the pulse. All of you. Take 5 minutes break and observe the pulse. All of you. Just observe the PPT. Check the pulse. Don't use all 3 positions, 6 fingers. No, just in any one position. In any one position, just observe the pulse. Either here, anywhere. Just check. Your pulse is starting from the root, or it is floating, or it is very feeble. Just check. So have you observed the pulse? There's many more different methods to observe the pulse. So some will be thin like this, some will be thick like this, some will be very slow rising, slow falling. Some is like wiry pulse. Okay, some will be knotted pulse like this. Some it is missing pulse. It is coming and sometime it is missing. So many more different ways the people are observing it. But so this TM course, we are learning to make it simple. So we learned all different organ concept within 20-25 points. That means simplest way. It's the liver yin or yang, kidney yin or yang, stomach yin or yang. We will learn this pulse even with that. Okay. We will check whether it's your given pulse is yin or yang. How to check? Come here. Look at this. The +2, which is indicating normal pulse. 0 or 1, it is the yin. 3 or 4 is a yang. Clear? Any doubt in this? Zero or 1, it is indicating in excess or yang deficiency. In excess or yang deficiency. 3 plus 4, it is indicating yang excess or indeficiency. Clear? I'll show you manually how to observe it. Look at this. If the pulse is beating like this, is +2. When you keep your hand, just beating like this. If it is beating like this, it is 1. See this, it is coming up to tip of the finger, +2. It is very feeble, it is like this, +1. It is meeting above this, that is +3, and it is floating upward with force, +4. So you have to observe two things, whether it is up or low, whether it is a yin or yang. +2 is normal. This is +2. Got it? Now, let's see where to observe it. So your pulse is divided into 3 warmers. The first position is upper warmer and middle position is middle warmer and the third one is lower warmer. Upper warmer, left hand we check the heart and small intestine, right hand we check the lungs and large intestine. Left middle we check liver and gallbladder, which is there in the middle warmer. Right middle we are checking spleen and stomach. In the lower warmer, so left is kidney in, right is kidney yang. But kidney yang in Sujok, they also tell pericardium and triple warmer. Pericardium and triple warmer, there is a excess yang. Even kidney yang is also root of all yang. So either you can consider right lower kidney yang or pericardium triple warmer. Left to lower is kidney and urinary bladder. Clear? So now the all in organ will be there in the deeper side and yang organs will be there in the superior side, superficial. So how to check deeper and superficial? Yang organs are superficial. They are outside the rib cage. In organs or vital organs, they are within rib cage and deeper in body. Got it? So now, when you place the pulse on the radial artery, just give 20% pressure. Just 20%. So that is your yang pulse. If I hold 20% here, it's a small intestine. Here gallbladder. Here urinary bladder. So here large intestine, stomach, and triple warmer. Just give a light 20-25% pressure. That is your yang organ. Just this much. See this? I'm giving pressure like this. Very small pressure. There is a yang. If you want to observe in, you give 100% pressure and remove 20-25%. Give 100% pressure, press, and just release a little bit. Got it? That is in. So here I'm checking heart, pressing and releasing little bit. Again liver, pressing and releasing little bit. When you're checking each and every organ, you have to check the table which I given to you. So don't forget this table. So I'm checking right hand in the middle position, stomach, just pressing. It is +3 is there. Spleen, that is also +3 is there. So stomach 3 and spleen also 3. So I conclude for myself, my side, right now the stomach heat is more or spleen insufficiency. In the middle warmer, heat is more. Right now, present situation. Spend little time, don't be in a hurry. You can understand this pulse and you can analyze better. Within few days, you become master in it. The pulse is the one, it is not only giving the present constitution, it is also giving you how you are by next year. All diagnosis tool which you are going for MRI scanning, ultrasound, and blood test, that is giving chemical and structural level changes, which is already happened. Already disease is begin and spreaded. But pulse is the one which is giving you much ahead. So today, if I am stomachache is more, I can understand. If I am not treating stomachache, by maybe next 1 or 2 months, I become end with gastritis, or I may get stomach heat, or that stomach heat may goes to the urinary bladder. I may get urine burning, yellowish urination, or stomach heat goes up, I may get headache. But right now I don't have symptoms. I can reduce stomach heat by just pressing stomach 36 or by putting Li11 methi seed, like that. So once you understand pulse, if anything is excess or low, you can treat. Even patient is don't have symptom also. Got it? And there is no threshold for anybody. Some may have excess or deficient. If they're feeling comfort, no issues. But if you want to increase, you can increase it. It's not a deal. Clear? If anywhere, if you're not getting pulse, sir, I'm pressing, I'm not finding anywhere. In the lung position, if you're not pulsing pulse, that because lung chi is very deficient. Yang is not there. Because of that, you're not finding the pulse. Yang means it's a chi. Yin is blood. So if any organ is absent, means that chi is very depleted. So you need to treat that urgently. Okay. So when you are checking, so always when you're taking pulse, okay, take the pulse from the thumb side like this. Or you take like this. Don't read pulse from the little finger like this. You should not read from this angle. You have to read from always from the thumb, your pulse has to go. Either you can hold like this or you can take like this. Sorry, you can like from the thumb it has to come. Either like this, either like this. It should not go like this. Clear? You can hold pulse every day. Don't go to the doctors or any missions. Believe your body only. Check. Oh, my urinary bladder yang is excess. Yes. Check each pulse. So all of you make one thing. Could make 2 lines. Yin organ, yang organ. Instead of that, what you are feeling? +2, +1, 0 or +3. Just write that. All of you do right now. I will tell you how are you now. Yes, Fido, any questions you have?
Yes, I have a problem. I feel my, how can I say? My heart beating, I feel it inside my head. And I can't feel the pulse in my my hands.
So if any excess heartbeat is there, means definitely there is it is happening due to indeficiency, either heart blood deficiency or liver blood deficiency. Okay, so just you sedate liver 3, that will subsidize. Okay,
Thank you.
thank you. Good. Just yourself right now. You check whether you are feeling 1, 2, 3. Just write that. If you are not able to find with 3, this index, middle, and ring finger, like this, if you are unable to find, then you take with the thumb. That will be more sensitive because you are using frequently. Like this also you can take. If you are unable to get with 3 fingers, use this individually. Like this. Like this. Check. Superficial yang meridians, deeper in meridians. Slowly, if you are not getting here, just move horizontally and vertically. You will get it. Yes, Deepthi, any doubt?
Yes, sir. So this pulse has to be in certain minutes, like certain seconds, like one beat in 1 second. There could be 2 beats in 1 second, and there could be 3 beats also in 1 second. So what is the time frame that we have to check for the pulse?
So here you take 2 beats or 3 beats. Just observe it is a +1, 2, 3 or 4. That's it.
So, but 3 in like 3 in how many seconds or how many minutes or how many?
Don't check the speed.
Then, sir?
See, 3 means not number of count. I am telling this amplitude. If you are beating, it's a 1, 2, 3, 4. This is amplitude I am telling. I'll write.
So we understood that amplitude has to be checked, but like I can have that amplitude in 1 beat also. I can have the same amplitude in 1.5 beat also.
Yeah, whatever it may be.
Okay.
Just check this. This is 0. This is +1. This is +2.
And sir, can it be different for a yin organ and a yang organ?
Normally for yin organ little less.
Okay.
Okay.
Fine, sir.
You cannot expect the same amplitude. +3 of the yang organ and +3 of the yin organ little varies. Okay. For yin organ little lower side only, but you can understand it's high or low.
Okay, sir.
Okay. So Nima, right? 2, 2, 1 you told superficial. So 2, 2, 1. So 2, 2, 1 means it's a definitely triple warmer. So kidney yang is less. Left shoulder pain, definitely yang deficiency. Just press K3. You'll be fine. If you are not finding 1, 2, 3, third, left end, third, if you are not finding. Ayush Sharma. Can you unmute Ayush Sharma?
The third वाला नहीं मिल रहा है.
Third, you are not finding here.
Uh,
You have to just start adjacent to this wrist line. This is a 1,
1.
3. So check it out. The third line here. If you are, you can hold the thumb. Check, check, check. Like this, you can hold. Not finding.
The first easily मिलता है. Second B.
No. First, you are taking little lower side. You take just here, just adjacent to this line. You're taking here. No,
Yes, sir. Yes, sir.
you have to take here, adjacent to this line. Don't give much gap between this joint and the pulse.
Okay. No, sir.
So if you are not finding third, left third pulse is 0, no?
Yes, a
Super-
little, sir. Come.
Okay. Left to lower or superficial?
Sir, बहुत हल्का है.
Low.
Yes, sir.
Then it is a kidney fire is less.
Okay.
All cold, cough, phlegm is related to lack of kidney fire. Just press K3. You can see the magical results. Don't do anything else.
Okay.
Done. Thank you. Abhi Usman. You can unmute.
Sir.
Hi, Abhi.
Sir, hi. Sir, mine heart. I have written the box. Can you see?
Yeah. I clearly observe heart and lungs is very low. Your upper warmer having a yang deficiency.
Okay.
Even your spleen and kidney also. That finally you are the guy with the yang deficiency.
Yes, sir. My all the limbs are cold, normal, on normal time.
So then, just a minute, please check.
But sir, GB and stomach is showing 3. Sir.
So what is your symptoms?
Sir, my all the limbs are most of the times a bit cold.
So that is due to yang deficiency, no?
Hands and legs.
And
Suffering from infertility issue, very low count.
so you do one thing, especially you are telling lung 0.
Hmm.
You have
I
to,
have no issue with lungs.
that lung 0 is there, no? Lung
Yes.
is the mother of kidney.
Okay. Yes.
Your kidney is cold because of yang deficiency. You cannot raise kidney without mother.
Okay.
So now you do one thing. There is a L11 point here.
Okay.
You press 20 times on both hands. After that, tomorrow evening again you check your pulse. You can see the changes. Okay.
Okay. Okay, sir. Thank you very much.
Thank you. Shanti. Shanti Bhupindran.
Yes, sir. Good evening, sir.
So look at this, madam. Yours.
Yes, sir. But myself is having urinary infection, sir.
For you.
Yes, sir.
So left to lower and left to superficial. Means kidney and urinary bladder is 1-1.
Yes, sir. It's indeficiency.
Not indeficiency, madam. Yang deficiency.
Sorry, yang deficiency. Yes, sir.
Just you go with SP9 sedation. Your kidney will rise.
SP9 sedation, sir.
Yes.
Okay.
And you do it tomorrow morning.
Okay.
Within 9 o'clock. And tomorrow evening you go for test.
Okay, sir.
So your urine infection will be cleared.
Okay.
Okay, fine.
Thank you, sir.
Many ladies are suffering with kidney and spleen yang deficiency. That is the root cause of your urine infection. Either put espinine sedation or press K3 20 to 30 times, or you put K3 pepper. Problem is solved. You can check by next day. You go for a urine test by paying 100 rupees. You can get check. Basic check is enough. The pulse count, everything will become normal. And also observe the changes in the urine. It should be pale yellow. Okay, that you can achieve this with this point. Who is this Faisal? Faisal, you can unmute.
Okay, unmuted, sir.
So you all are 333. So you are the guy of yang indeficiency.
Young deficiency.
Yang excess, in is less.
Oh, okay, sir. So what do I do, sir?
So where is yang excess, you have to find out, because your all yang is +3. Then you cannot get next information pulse. You have to check the tongue or symptoms. Because the small intestine, gallbladder, urinary bladder, all yang is excess. So any symptoms of yang excess?
The pressure was high today.
Blood pressure.
Yes.
Then you go for stomach 42 sedation.
Yeah, extraordinary high today. Quite abnormal. Never was like that.
Don't worry, you just put one methi seed on ST42 and go for checkup tomorrow morning. It will be reduced.
ST42, sir.
Yes.
Okay, sir.
Thank you.
Said it, sir.
Said it.
Thank you, sir.
Thank you. Anand Yoga Mandir. Ahmedabad.
Good evening, sir.
Good evening. Sir, your especially your spleen, lungs are 0.
Ji, sir.
Liver also. Liver is 0. Have you checked?
Just a minute, sir. Again, I check.
Be careful. You are all having 0 in liver pulse. That means your heart is not getting yang energy. Press 100% this pulse, this middle finger, and leave 20-25%. Yeah, exactly. Don't give gap here. Just adjacent to this bone you take.
Okay, sir.
Yeah, exactly right. Yeah, exactly. That is the pulse. Like this, like
Sir,
this.
zero.
Huh?
No movement, no pulse.
No pulse. So, if liver don't have yang energy, how can it nourishes your heart? So how is your heart condition? Are you feel breathlessness while walking?
No, sir. I am quite okay.
Right, okay.
Sir, I do every day aerobics.
Aerobics. So any heart conditions?
No, sir.
Then you have to.
Only as from some few days due to over workload, I am feeling some tiredness.
So tiredness is a Chi deficiency symptom only.
Sir, now I am feeling one pulse, only one.
Yeah, one also it is a yang deficiency only. What is your age?
56, sir.
56. If you don't want to get heart issues till even 70-75 means, till your heart liver pulse rises, you just press liver 3 20 times weekly twice.
Okay, sir.
Once liver pulse become +2, then you stop it.
Sir, liver 3 is the center.
No, put main point you do in the leg.
In the leg.
In the leg,
Okay.
you just press. Okay.
Okay, thank you. Thank you very much, sir.
Thank you very much.
Anything, sir, anything else?
I am checking, rechecking. Just a minute. Anand. Liver. Spleen also 0. Spleen. Digestion is very weak. When digestion is weak, in the near future, your food which you are taking, it converts into toxins. It may create some gastric problem, food stagnation, or cholesterol excess, blood sugar variation, all those things. Keep your spleen pulse always +2. Okay.
Sir,
Yes.
which pulse?
Spleen, middle one.
Middle one.
1, 2, 3. How much?
No pulse, sir.
Okay.
Sir, is it okay? I am pressing.
Correct. Press 100%, leave 20-25%. Yeah, exactly.
Only one pulse, sir.
So +1 is indicating spleen yang deficiency.
Yeah, sir. I also just feel spleen yang deficiency.
What do you feel?
Just, sir, there is some constipation.
Okay. So for you, I have to raise the spleen yang. So my suggestion is press stomach 36 weekly twice.
Stomach 36.
Until your spleen pulse become +2.
Stomach 36 twice a week.
Yes.
And liver 3, sir.
Yeah.
In leg.
You have to press until it become liver pulse is +2.
Liver
3.
Liver 3 in leg.
Yes.
And ST 36 twice a week.
Yes.
Okay, sir. Thank you very much, sir.
See, pulse is giving the data much ahead. You should not neglect. Oh, heart is 0, I don't have heart problem. The liver is 0, I don't have liver problem. No, it's not like that. I'm not talking about the physical of your liver. Just imagine how liver yang is performing your body function. I took one full day class for that. The function of liver yang. Go through videos. Okay. Yes, Naveen Chandra.
Left, there is no pulses. Not able to feel. Even Adishara when tried also, he could not get any pulses from the left hand. Right hand, I am able to get it. All the 3 I am getting.
So left means it's a liver and heart only.
Yeah, I had a heart surgery, bypass surgery. I had done 25 years ago.
Okay. So you do one thing. Weekly one. See, if the vein is removed and put it in the, it's used for the artery surgery means you would feel. Then you cannot consider that pulse 0 or 1 doesn't matter. Pulse, the radial artery itself is not there, no? They removed.
Yeah, removed. You can see this.
Yeah,
There is
yeah.
no artery.
That there is no artery. If it is removed means, you show your hand, left hand like this. It is removed.
Yeah,
It
it is
removed and used for bypass.
bypass. Yes, yes.
So you
Here I
cannot,
am getting.
then you have to get the data of liver and heart with the, one hand only. So within that also you check. So one hand only, how is upper and middle and lower warmer?
All are like this.
So all are +2 or +3?
All are going. I'm not sure if it's +2. See, all are I am getting 3.
All are you are getting. So that's fine. Nothing to worry. Your yang is good. But you, if all are getting more means there is a indeficiency. How is your sleep?
Sleep getting disturbed because of the urination 2 times in night. Otherwise, immediately I get sleep. sleep is not an issue for me.
Once
I
you
am
go for
fresh in the morning.
urination, you take time again to sleep back.
No, not much. Once in a while, take little time. Otherwise, immediately I sleep. I done SP9 sedation, K5 sedation also done. As per
After
your
that,
paper.
urination reduced.
That one, it's coming. My present issue is constipation. Now bowel movement properly.
Check
And
the
the
first
skin
pulse, how it
disease,
is. How is the first pulse superficial, large intestine? +2, +3, +1. Check this.
is low.
Yeah. So it is low means large intestine. So you put one pepper on LI4, large intestine 4, that initiates your bowel. Okay. Fine.
Because of the after the starting of the constipation, there is a skin issue here, here, and
Do
in
you
the
feel burning sensation?
thyroid also. No
Burning?
burning sensation. Small dot-like things current. It was small 4 months ago. Now it has spread throughout.
The small dot you are finding, it's a reddish or darkish?
Reddish. Once it is reddish, then once it is dried, it becomes brown. Now it's only outer dot is coming. If I apply some ointment, it goes down. Then 3-4 days time, it comes again outer ring. So it was small earlier. Now it has become big like that, and outer it is coming.
You put LI4 only because there's an infection kind of thing. So by raising yang, you can clear that. Okay. So if any variation after 1 week, you text me back.
Yeah, I had done indication that is, he said you LU7 tonify. So 3 days before I tonified LU7.
Any changes? Any changes?
Only 3 days ago.
That's what. Within a day also you find the changes.
No changes.
So by raising LU7 is raising the yin, no? By raising the yin, you are not finding the change. Now you raise the yang with LI4 pepper. Okay. Fine. Good. Thank you.
Thank you, sir. Thank you.
Hello, Smriti.
Good evening, sir.
Good evening.
Sir, I'm trying from a long time, but I'm getting different readings. First, I was getting 3, 2, and 0. Now I'm getting 2, 3, 1 in both the hands.
So lower is 1.
Lower is 1. At first, it was 3 was high in both, but now it's 2, and the middle is 3 now.
So middle is 3 means definitely liver yang.
Liver yang.
Any symptom of liver yang?
So indigestion, irritation.
The liver or gallbladder, which is high? Check.
Okay.
Middle pulse. Liver or gallbladder?
I'm checking middle pulse. Sir, I think it's a gallbladder, sir.
Yeah, irritation is gallbladder, not liver. So best point is GB40.
GB40, so I should sedate it, sir.
Yeah.
And so in the right hand, so again 2, 3, 1.
2, 3, 1. 2, 3, 1. Stomach is 3.
Stomach is 3, sir. I think there's a little heat because I was getting a boil in the nose some days back.
Don't worry, GB40 will solve everything.
Okay, so one more thing I wanted to ask, so you were analyzing the palms that day. So even my little finger is little.
Yeah, wider. So how is the heart pulse?
So the heart is 2 in the left hand. Over here.
Where you are checking, Baba?
So the left hand.
Not below the finger, little finger below the thumb, you have to check.
Oh, so I thought that was small intestine. So this is 2, sir.
No, superficial small intestine, deeper heart.
Oh, okay.
Superficial, deeper.
So the heart is very strong.
High.
I am getting very current. I'm getting current. In this. I'm listening to current coming in my own hand.
Current shock is coming.
Shock is coming.
So yang is excess. You just press H8.
H8 here, sir.
You just
So I,
you press
I'll,
20 times. By tomorrow evening, that heat boil won't be there.
oh, this is gone, sir. It's gone. It's gone.
When it gone?
Yesterday.
Yesterday. So if it is not there, you can just press. If heart
This
is
is pain.
if the heart pulse is excess, just press H8. This is H8.
Yes, it's paining. If I'm pressing, it's paining.
Spinning means you just press once a while. Okay. Thank you.
So, and so GB48 should I set it, sir?
You can do right now.
Okay.
Fine. How to see large intestine? Large intestine right hand, heart left hand. Here heart and small intestine. Superficial heart, small intestine. Press deeper heart. Clear, Raghavendra? Ravindranath. So which I told it's clear for you.
Hello, sir. Actually, basic, I am getting doubt. You are telling same point, intestine and heart, bladder and liver like that. They basic itself, I don't know how to check.
It's a basic. It's not big deal here. All are freshers here. Look at this. Just give 20% pressure. It's a small intestine.
Actually, I am feeling left hand, right hand, both are 2 to 1 like that. I am feeling.
So that's what. Press superficially small intestine. If you press deeper, it is a heart. Deeper means you have to press 100%, leave 20%. That is deeper pulse. Superficial means just press 20-25% pressure here. Same position. You no need to change the position. Superficial small intestine, deeper heart.
Because I am getting 2 to 1 in both hand.
2 to 1. 2 to 1 means it's a kidney in is excess, kidney yang deficiency.
Yes, actually, even Nadiswara also it is showing kidney Q, this one like that.
Deficiency means some or other way you will get the symptom of kidney coldness in the body.
But actually, I mean, nowadays I am getting sleep, getting some problem, and body always too much hotness like that.
So kidney yang deficiency due to yin deficiency. Then you can treat yin deficiency or yang deficiency will go off. Just press, put Li11 methi seed. So that will raise the kidney yin so that it will recreate the kidney yang.
So Li11 SADC then.
Yes, that's it.
Okay.
Okay, thank you. So you can take pulse when you are relaxed and without anxiety, before food or after 2 or 3 hours of food you can take. Clear? Give equal importance to all 4 different diagnoses: symptoms, interrogation, occultation, and observation. So pulse is a tool to cross-check. If you are wrong in symptoms, then you can rectify that with the pulse. Okay. Yes, Jogi.
Hello, good evening, sir. I am having on the left side. I am having the pulse for bladder and kidney. That's low, but otherwise all the pulses are high.
So normally, this is called Vata, Pitta, Kapha.
Okay.
So compared to Pitta and Vata, Kapha is a little lower. Don't
Okay.
expect even kidney pulse is higher like liver pulse. It's a little lower, but too much lower you have to consider. It's a yang deficiency.
I think it's a yang deficiency.
If your pulse is very feeble means, then it is a kidney yang is less.
Because I'm having lower back pain sometimes and
It's a kidney yang deficiency.
kidney yang deficiency. So what would be the point?
You just sedate liver too, your low back pain will vanish.
Actually, I put some methi seed over here, and it is over now.
Yeah.
But
you can apply black line also, that works.
yeah, I did that.
Fine. Thank you.
Okay, thank you, sir. Liver too.
Liver to sedation.
Thank you, sir.
So Vaishali is asking which types of pulse are normal. If the pulse is beating high, is a yang excess. Low is in excess. If you are beating in between, it's a normal pulse like this. It's a normal pulse. This is yang and this is in. So check out. If it is beating like this, it's good. +2. +3 should not be there and +1 should not be there. Clear? Yes, Vaishali, any doubt? No answer. At 2 is normal. Yes, Anis.
Good evening, sir.
Good evening.
Sir, mine is 231 on right hand, both yin and yang, but left I don't feel any pulse at all, sir. I tried a lot, but I don't feel any pulse.
What is your age?
48, sir.
48. Right is not pulse.
Right is 231, sir.
3-1. Left?
Stomach and spleen are more. Yeah, left I don't feel any pulse at all.
Like a previous student, that vein is removed?
No, sir.
You vary the horizontal position, vertical variation. No
I
variation.
tried even with thumb, sir. Yeah, I tried.
Not getting. Then it's very clear. The liver and kidney yang deficiency.
Yeah, I get migraine attacks frequently, sir.
Then do liver to sedation.
Okay.
And let me know the changes after 3 days.
So one more thing, sir. With the lunar dates, I feel like arthritis pain, sir.
During afternoon?
Full moon. Both the times I feel lazy and feeling sick, sir, at these times. Both the like full moon and no moon.
So it's arthritis, so only particular time means it's a yang is less. You need momentum in the joints. Just do, not now, tomorrow morning you do liver to sedation and let me know the changes after 3 to 4 days.
Okay, sir. Thank you so much.
Yes, any other question? Varsha?
Hello, sir.
Hello.
Sir, both hand, first is 1, second is 2, third is not finding.
First is 1. So,
And in this hand, deeper is not finding, left hand.
so that means heart and lungs, yang is less, G deficiency is there.
I have breathlessness issue for height.
Right.
Yeah,
And the kidney also 0.
I have foot swelling. Yeah,
Together is best point is K3, just press.
just press on. Heart problem also solved, breathlessness.
Yes, everything will solve.
Okay, sir. Thank you, sir.
So 1 week you press K3, next week you press liver 3.
Liver.
Just, yeah, just you do 2 cycles and let me know the changes.
Yes, sir. Definitely. Thank you, sir.
Yes, Yashoda. Yashoda. You can unmute.
Yes, sir. Good evening, sir.
So,
Sir, liver and stomach, I'm getting it as young excess. And lungs, heart, kidney insufficiency. Am I right, sir?
yeah. Any symptoms which is related to digestion?
Ha, sir. Yeah, like my tongue coating, like last time you had seen, half is young excess, left side, right side is full coated, and legs 24/7, 365 days, I have to wear socks.
Because kidney is 1.
I feel very cold.
Have you pressed liver 3, K3?
Yes, last K3 Nesa, last class you said to start with SP6 sedate. I did that after 4 or 5 days. K5 yesterday, K5 sedate I did, sir. 10 minutes.
Changes you found?
Ha, sir. That now, okay, like last 2 days, I'm not wearing socks.
Oh, so which is their last few years, it is gone now.
Yes, sir. 1 whole year I won't, sir. 365 days socks. People make fun of me, sir.
Now onwards, you won't wear.
Okay. And my tongue also, that one side that redness was there, that peeled one. That's little dimmed down.
Dim down. Fine. Use just press K3 2 more weeks.
K3 2 more weeks, that is twice a week, 20 times.
Yes.
Okay.
And one more thing, you are wearing specs, no?
Yes, sir.
So I made one video which is there in Kannada language. Don't worry, you can understand that.
Yeah, I understand Kannada, sir.
In Basava IQ Academy, I made one video on eyesight improvement.
Okay.
I uploaded 1.5 months back.
Okay.
Just in 1.5 months, I got 7 to 8 feedbacks from the users. Practiced the techniques which I told, including acupressure point. I taught some exercises of eyes.
Okay, sir.
The eyesight is cleared.
Oh, great. This is my reading class, sir. I didn't have short sight throughout.
Whatever it is, even 20.
I can work on it. Okay, okay.
So
one more.
many of you are wearing the eyesight issues. So maybe in another 1 or 2 weeks, I will upload video in English also.
Okay,
Right now, which is there in Kannada. you can understand at least which are all the acupressure points and exercises.
No,
which
I speak Kannada, sir.
Then you can understand. It's a YouTube channel, Basava IQ Academy.
Okay, sir.
So you can check that video. It's a 1.5 hour video is there. Carefully observe the video. I told everything in that 1.5 hour to come out of that eye issues. It may be eyesight issues, reading issues, or glaucoma problems, or eye dryness issues. You can practice that exercise. It takes only 8 to 10 times, 10 minutes in a day. If you do once, okay, definitely within 1 or 2 weeks, it will clear.
Okay, sir.
So don't worry, within 1 or 2 weeks, I will do it in English and I will upload.
So one more thing I wanted to tell. I have had an injury. I have a C5, C6, C4, C5 slip disc. That's 2 years back. Back L4, L5, L5 and S1 slip disc. And that backache on and off, it keeps coming, sir.
It will go with by pressing lever K3.
So I had met you also last time. Yeah, I had come to your center. So I'm doing those points what you had said. In that case, yeah.
Will be fine. So I'm sure that you won't wear socks now onwards.
Okay, sir. Thank you. Okay, thank you, sir.
Yes, it can. It's eye exercise. Only giving pressure and giving warmness and pressing some acupressure points. I told anybody can practice. Even if you have a glaucoma, even a cataract surgery happened, anybody can do this. Okay. So within 1.5 months, 6-7 patients, they're not wearing specs means definitely you can do. It's a practically proven method which we thought. Okay. Maybe in Joshi Kerala group also we will take one class on that eyesight improvement. That time we will do it in English and we will upload that in here. Okay. Thank you. So I will tell you, if anybody of you getting 2 or 3 different readings within 1 hour of half an hour through Nadiswara means the problem is from your side, you are wearing the pressure of the sensor. So while taking Nadiswara report, make sure that your amplitude you are getting high and clear and uniform throughout 20 seconds. Then only go for analysis, otherwise you retake. If your pulse, if you are taken correctly, your Nadiswara, it shows constantly the same result. Feasibly, it won't change. It will change only once you yield, once your constitution changes. Otherwise, plus or minus 10%, it will be in the same order only. Okay. Thank you. Pulse diagnosis practicals in offline in Mumbai, definitely. So I am like a half bachelor now. So if you call anywhere, I will come. Okay. Mumbai, Delhi. So I need people to teach, to listen my words and my research. Okay. Sure, we'll meet in Mumbai. So got it? Any other questions? Yes, Smriti.
Sir, sir, can you hear me?
Yeah.
Sir, I'm getting 231, 231. So like you said, Vat Pith Kaph, even when my Nadishwara had come to you, so the pith was very high. So do I do something for that? And even I was not getting sleep till 2 in the night. That's why you said there was a liver problem.
Liver insufficiency. So in Nadiswara, Pitta is high.
Yes, sir.
Then you can make one methi seed on GB40.
GB40. You just told me GB40. Yes, sir.
So you will get very good nice sleep. Your irritation comes down and everything will be saturated.
Okay, so nothing to do for the pitta, sir. So the pith.
The GB40 sedation will reduces the pitta.
Only once, sir.
Only once. Okay, fine. Thank you. So fine. So Faisal, So, any more questions?
Yes, sir. One problem here. I'm having it for 2 years. I'm a diabetic. Having a foot ulcer, this doesn't seem to heal.
Foot ulcer.
Yes,
Any liquid oozing out of it?
yes. It is just below the big toe.
If it is
Because I
below,
have to walk.
below the big
Yes.
toe, so definitely
Yes.
liver.
Left leg.
Yeah. So left side means it's a in. Below the thumb means
Yes.
below the thumb, say it's a 2 meridian is coming there, liver and spleen.
Yes, just below here, below the big toe.
So below the big toe means my suggestion is it's better to go with liver to sedation.
So how often do we do this liver to sedation, sir?
Only once is enough, sir. You wait
I've
for
already done that 1 week ago.
1 week ago means you wait. The oozing has to come down. It is coming down or not?
It depends. It's not definite, but every day is oozing.
Liver 2 is the best point. You do
Okay,
it
sir.
tomorrow morning. You do it tomorrow morning and update me changes after 5 days.
Okay, sir. Thank you, sir.
Thank you. If the liver 2 also it little bit is remaining means then the second point you can put SP9.
What's that?
SP9, second point.
Oh, SP9. First the liver 2. I do it liver 2 first.
Because why I'm telling liver 2 means the oozing happens from the muscles. The muscle is
Yes.
controlled by liver. Reduce the
Yes.
liver coldness so that oozing will stop. The second
Yes.
point SP9 because there is a dampness. You have to reduce that also. These 2 points it will clear.
Okay, sir. It's already 2 years, sir.
Already 2 years.
2 years ago I started.
But
So it's a great.
if you follow me, I will clear within maximum 3 to 4 weeks.
Okay, sir. I'll do that, sir.
Sure. Thank
Because nuisance, I can't even do my jogging.
100% it works. Around the wound, you can even apply the dark blue color.
No, just here inside the toe, where the pressure point.
Yeah, understood. If the wound is small, you can apply a dark blue color around it. The dark blue color is drying the wound.
It's quite big, sir.
Quite big means no need. Just apply first liver 2. After 5-6 days, SP9 sedation.
Okay, sir. I do this.
Thank you.
Thank you, sir.
So fine, very good. So is it clear for you? Don't end up with the confusion. There's a many more in the pulse, but start with what I'm telling. Because you learned the yin and yang of the each meridian, it's easy to correlate and compare. So now I explain 10 pulses. All 10 are matching to the patient. Carefully you observe, just write +1, +2, +3 or 0 with respect to each meridian. Based on that, you analyze. Any more question? I will share you the PPT. It's a used PPT. I will just go through. Many more things I written, but practically this is enough for you. So sleep time itchingness is a gallbladder only, GB40 sedation. Anybody of you getting itchiness in the sleeping time? So sleeping time is gallbladder. Just GB40 sedation is enough. So which I shown you the PPT that I will share you right now. Okay. Just practice, just go through the PPT today and as well as video. Tomorrow, I will combine both pulse and tongue together and I will explain you how to diagnose and how to find out the single point. Clear? Cracks in the foot, it's a lung heat only. So you could just go with the LU10 sedation or LU7 tonification. So EOI points I will give you next week. Okay. Fine. Thank you very much. See you tomorrow. Before tomorrow's class, brush up tongue diagnosis PPT and pulse diagnosis PPT and as well as recordings. Tomorrow we will check together. We'll take 10 to 15 examples from your side only. We'll compare both. How is the pulse? How is the tongue? And how is the patient symptoms? And how to conclude with these two diagnoses and how to find out the point. Okay. Thank you very much. See you tomorrow sharp 8 o'clock. Don't delay. Thank you.
Thank you so much, Basavaraj sir. Today we had learned about pulse diagnosis, and tomorrow we'll be learning more about pulse and tongue. So let us all meet tomorrow. And thank you, Basavaraj sir, from all of us and Joshi's Kerala group. Good night, everyone.
Thank you so
sir.
much.
Thank you, sir.
Thank you, sir.